Hello, everyone. This is our first screencast for week number 2. And in this particular screencast, we're going to be talking about your major assignment, the writing of a term paper. So let's talk about writing the term paper, what it's going to look like, and also what is scientific or professional writing, what that looks like too. So for your assignment, you're going to write a minimum of 5 double-spaced pages. You may write more, that is fine, but we want a minimum of 5. That should be a bare minimum to really start fleshing out an idea or our ideas related to the topic. And I'll discuss the topic here in just a bit. You're going to use 12-point font, and please use Times New Roman. This final project, this written assignment, is due by Monday, April 22nd. So we're exploring this here this week, giving you the opportunity to get after things and start the process. So what are you going to be writing about? Well, the topic is wide open, and I'll give some parameters here in just a bit, but things should be related to our course content. So we're going to be exploring, of course, psychosocial implications of disease and disability throughout the term. So you're going to be looking at a particular disease and looking beyond how you might normally treat that individual, looking at the implications associated with that particular disease. So I would like you to explore the relationship between a population you treat and the psychosocial issues that that population frequently experiences. So a lot of times when we review research literature that's specific to our discipline, the focus upon that traumatic injury or that chronic injury is on how that injury impacts function. So for example, somebody that's had a stroke, you may be reading an article or a textbook on how a particular stroke impacts one's ability to ambulate, or for example, how to use an upper extremity. Or maybe you work with individuals with chronic low back pain, and the paper may discuss limitations in range of motion, how it affects their range of motion, how strength is diminished or impaired. So it affects somebody's ability to move with pain. Now, as a PT, that's my primary background, a physical therapist, I am concerned with how one post-stroke is able to get out of bed, or their ability to stand up, or their ability to go for a walk with or without an assistive device. But how does one's disease impact the psychosocial side of that individual? How does it now impact their ability to interact with their family or friends? What is the impact upon a significant other? I've got stairs in my house. If somebody were to become paralyzed, what does that impact upon what I need to do within the home? I don't have any bedrooms on the ground floor. How does that impact my relationship with that individual? Does the disease impact their ability to work? How does it impact their mental health? Is there a relationship between the disease and their future physical health? So throughout the term, we're going to be exploring these different chapters, and these are just some of the psychosocial topics that we're going to be exploring. So you may want to jump ahead if there's a particular area that seems interesting to you, that seems appropriate for the patient population of interest to you, and look ahead, explore those chapters, or just look at those key words, understand aspects of psychosocial implications, and use those to help you with your literature review search for your paper as well as for your screencast assignment. Now, the screencast assignment I will discuss in a subsequent screencast this week. Now, some of the topics that we're going to be exploring throughout the term may not be relevant to your research topic, and that's okay. Again, the topic is really wide open. So here's an example. As a physical therapist, I treat a lot of patients with chronic low back pain. Chronic low back pain gets that diagnosis when the back pain has lasted longer than 12 weeks. Now, clinically, if I'm working with a patient, exercise is a top conservative treatment for that patient population. So I have a little screen grab here from a clinical practice guideline published by the Orthopedic Academy, the American Academy of Orthopedic Physical Therapy. And what you can see is there is A and B scores for the use of exercise, different exercise interventions for people with chronic low back pain. You would think, based upon those A's and B's, that would take care of things. But I know many patients with chronic low back pain have challenges getting better and may have pain for many years or may fail to make gains when I work with them. Now, sometimes people with acute low back pain, it becomes chronic or persistent low back pain. And I'm not asking you to answer the question why this happens, why somebody develops persistent or chronic low back pain. What I'm curious about is how chronic low back pain impacts the psychosocial domains for the patient. Or maybe you work with people with traumatic brain injuries, or maybe you work with people post-stroke. That's what we're interested in with this paper, is how the disease or diagnosis impacts psychosocial domains for that patient population. And what's interesting here from this particular article is, if we look, almost 1 in 4 patients with severe chronic low back pain reported a psychological comorbidity. So that's something we would be interested in. We would be interested in that because how does that comorbidity have an impact upon that person? Also listed here, substantial subgroup of patients with severe chronic low back pain had been prescribed opioid medication for more than 5 years. Psychosocial, is there addiction resulting from the use of medication for that long of a period of time? So what is your paper going to look like? You're going to have an introduction section first. This is where you're going to define the disease or that diagnosis. I want you to discuss the prevalence and or incidence in the population. The prevalence is that point in time, a cross-sectional analysis where you're like, 10% of the population at any point in time has chronic low back pain. That would be prevalence. Incidence is the number of new cases that occur in a year. So, for example, you might say the incidence of stroke in the US population is 1 per 100,000 people per year. So there are 2 different ways of measuring the rates of something. Make sure you use the terms appropriately. So we're getting an idea about the disease, describe it, how common it is, and then how does the disease impact the short and long-term health of that individual? So this is where you would talk about what the disease does to that individual, What kind of medical care do they get in the short term? What kind of medical care do they need in the long term? And relate it to your discipline. In addition, also relate to, other things that might occur, like if I was a physical therapist or I'm a physical therapist and I'm talking about somebody with chronic low back pain, I might discuss that they might see other practitioners for their musculoskeletal health, including orthopedic surgeons, physical medicine and rehabilitation doctors. There may be other interventions that are used, medication use, injections, surgery, things along those lines. So this section should be about 3 to 4 paragraphs, so you might be close to a page. Section 2, this is the psychosocial challenges for this patient population. What are the common challenges? What are the domains related to this disease or diagnosis? So what do I mean by common challenges or domains? Does it impact employment? Can somebody continue to work? Does it impact their mental health? How does it affect social interactions? Things like that. Now, under the major header of psychosocial challenges for the patient population, you should present a sentence or two under this major header describing the common challenges and describing these domains. This does not mean that you will have to cover all of these domains. There may be numerous domains, but we only have to write a minimum of 5 pages overall. You may write more if you want, but you could see how potentially if you covered every major challenge or domain, it could be a substantially very long paper. Now you're going to have subheadings related to mental health, employment, social interactions, things like that. So 2A, 2B, 2C, 2D, etc. The number of subheadings or sections you have is up to you. The paper, again, should be a minimum of 5 double-spaced pages. Your introduction, again, will be approximately 1 page. Section 3, these are the interventions and resources needed to address the domains explored in Section 2. So, for example, if you had a mental health section in Section 2, then you should have a section on treatment. Now, as a PT, I don't do mental health care, but I would want to recognize that maybe a substantial number of individuals are suffering from depression or anxiety. And I would want to describe in this section who would be the appropriate practitioners to treat these individuals. How would I know that an individual has depression or anxiety? Is there any screening tools that can be used to determine that? And what research can you find related to outcomes? So if somebody does go to a mental health care professional, like a psychologist, how does treatment from a psychologist improve aspects of their mental health? Make sure that your focus is on that disease population. So I'd want to be looking for treatment of chronic low back pain patients and depression. I wouldn't want to be just looking at depression in general. So I'd want to see, hey, is there information on improvement in their mental health scores? Is there improvement in their pain scores? So you should have a section here exploring the literature, exploring the research related to that topic. You should have one section for each. So if I had a section on mental health, employment, and social interactions, I would want to have a section related to employment, mental health, and social interactions. Section 4, what limitations are there in the literature? What could you not answer or answer very well? What areas need improvement in how we care for this population? This is like a conclusion section. This gives you a chance to kind of summarize limitations that you found. Section 5, last section, is your references. Within your paper, please use a superscript. So whenever you have a citation, use a superscript. Order your citations in your reference section in order of appearance in the manuscript. So we're not worried about alphabetical order. Whatever your first citation is, that should be then number 1, and it doesn't matter if it starts with an A last name or a Z last name. So it's in order of appearance in the manuscript. You may use AMA or APA format. I know that the APA format is used by a lot of individuals in the University of Medical Sciences, Arizona. I don't like APA. I use AMA because the majority of journals that I submit papers to use AMA. Here's the difference between the two. This is for a journal submission. You may use AMA or APA, but whatever format you use, be consistent. Here's links to reference guidelines. So previously, these showed journals. We're going to primarily be using journals, but in case you need to cite something from a web page or a textbook, you can go to the PowerPoint, click on these links, and it will take you then to a PDF which shows how to reference things correctly based upon your source material. Scoring rubric. So here are the points for each section. What I want to see, and again, there is some subjectivity to this, but we're looking for depth in each section. We don't want to just be superficial in our writing. We want to have some depth to it. So deductions are going to occur if there is a superficiality or a lack of depth in a particular section, or if there is grammar errors, spelling or punctuation errors, and then incorrect reference formatting. Now, tip for scientific writing. First, organize your thoughts, ideas, and actions in a logical manner. It might be helpful for you to write an outline prior to doing your literature review search and starting to write your paper. You know your patient population. You have an idea probably already as to some of these psychosocial domains that you want to explore. So start putting your thoughts down and putting down everything you kind of know in an outline form. Next, provide clear descriptions when you write. What this is talking about here is as you write, with scientific writing, even if your audience is familiar with the topic, you assume that they don't know the topic. For example, I see this all the time in medical journals. Let's take the topic of a frozen shoulder or adhesive capsulitis. The first paragraph will start by stating primary idiopathic adhesive capsulitis, comma, also known as frozen shoulder, comma, is a condition marked by significant range of motion loss and pain, period. Very simple starting sentence. It's something that everybody knows who's reading that journal, but it kind of sets the stage. And then they might go into something along the lines of adhesive capsulitis, or the exact cause of adhesive capsulitis is currently unknown, but it is thought to be a result of an endocrine disorder. Adhesive capsulitis occurs in 3 or 4 stages, depending upon which model of staging you subscribe to. Initially, there is the injury, and that is the freezing stage where there is progressive loss of range of motion and increasing pain. There is the frozen stage where there is maximal loss of range of motion and pain. And finally, the thawing stage where range of motion starts to get restored and pain lessens over time. Next, simplify your word choices. Utilize clear, straightforward language to ensure that people can comprehend and engage in your topic. Write concisely. So you want to avoid lengthy or needless descriptions and paragraphs. With scientific writing, you are trying to get to the point. You're not trying to use excessive flowery language. You're also trying to make sure that you are presenting the evidence and not making assumptions about the evidence. Next, use passive and active voice appropriately. In scientific writing, it is important to know when to use each voice. Using an active voice makes your writing more natural, direct, and engaging. And this may be used when discussing widely accepted findings. The introduction section could utilize an active voice because it narrates the what is. However, when discussing the results, it's advisable to use the passive voice. Now, I would say it's best to use the passive voice throughout this manuscript and to avoid using first-person language. Next, select the most appropriate words. Selecting the appropriate words can be challenging. The best words accurately capture what you're trying to convey. If a word is not sufficiently precise, use a thesaurus to replace the word or phrase with a more appropriate word. Precise words allow for specific, clear, and accurate expression. Scientific writing is different than writing for literature that is fun to read. So again, you're not trying to be colorful with your language. Next up, broaden your vocabulary. Use clear, specific, and concrete words. Expand your vocabulary by reading in a broad range of fields and looking up terms you might not know. Avoid filler words. Filler words are unnecessary words that are vague and meaningless or do not add to the meaning or clarity of a sentence. Read what you write. Ensure you vary sentence length to maintain reader engagement and avoid a monotonous rhythm. However, don't create excessively long or convoluted sentences that might hinder the reader's comprehension. Next, optimize paragraph and sentence structure. Each paragraph should present a single unifying idea or concept. Extremely long paragraphs tend to distract or confuse readers. If longer paragraphs are necessary, alternate them with shorter paragraphs to provide balance and rhythm to the writing. A good sentence allows readers to obtain critical information with the least effort. Next up, use transitions to control the flow. Sentences and paragraphs should flow seamlessly. Place transitional phrases and sentences at the beginning and end of the paragraph to help the reader as they move through the section. Word repetition. Avoid repetitive uses of the same word or phrase. Opt for a more descriptive alternative whenever possible. Make sure you're not using the same word in a sentence twice. Improve readability with consistent formatting. Although in many cases it is no longer necessary to format your manuscript for a specific audience prior to getting published, you should pay attention to formatting for consistency. So what this is talking about here, and this one may not be as relevant for us, is something for journal purposes. What I'm having you do is use the headings, the format described earlier. So make sure that, like, for example, when if you have a 2A section that deals with mental health, you should have a 3A section that deals with mental health, so I can see back and forth between the two. Next up, maintain consistent use of labels, abbreviations, and acronyms. And so best one here is like abbreviation for like chronic low back pain, the first time you use something, you need to spell it out, but then in parentheses, you would put CLBP for chronic low back pain, and then use that throughout. Don't use LBM, low back pain. That would be confusing. So be consistent with that throughout. Use abbreviations and acronyms because that can help shorten your paper. And also, if you're like doing something like stroke, you could put, or cerebrovascular accident, you could put CVA and then use CVA. That becomes easier to read in the manuscript, and it isn't as repetitive as reading cerebrovascular accident each time. And then read your writing out loud. Make sure you take time to read it over, read it out loud. That helps you, quote unquote, hear the mistakes you might have written. And finally, if you get the paper done early, like a week or two before it's due, I'd be happy to do a one-time review to suggest edits. And there won't be any consequence to your paper grade. Also, I'm available throughout the term to bounce things off of. Like if you're having trouble writing a sentence, email that to me and I can give you some tips. Please ask me questions. That's what the email is there for. What I don't want to do is be doing page by page throughout the term. I want to take a look at the whole paper at one time. But if you've got little things here and there, like, hey, I'm having trouble with how I might write this sentence, then we can work on that. All right, so other things we're going to be talking about this week is how to use the library here to find articles, and also discussing your screencast assignment. Your screencast assignment can be quite similar to your paper.